Are you struggling with low back pain and you just can't get it to stay away for good? I'm here to tell you that strengthening is your answer. I'm Doc John from Mobility Doc, and we've been tackling the topic of low back pain, and we have recorded a number of videos on what low back pain is, trying to debunk and demystify any of those myths and misconceptions. We've also created videos on your first steps around getting out of pain, and I highly suggest if you are currently in a good bit of pain watching this, I highly suggest you go back to what you can do while you're in pain and watch that video first. This is for those of you who have your pain under control. Maybe you still have some discomfort, but it's largely under control. You're not concerned that any moment you're just going to go into a full spasm, right? And I want to show you my favorite exercises on how we help our thousands of patients every single year get out of their low back pain. So without further ado, let's get into it. I want to talk about RDLs, or Romanian deadlifts. We're going to start there, and it's something that a lot of us have seen before, but it's something that is often done improperly or maybe underappreciated at the very least. And that is because the RDL is more than just an exercise that automatically improves your low back pain. The important part of the RDL is the ability to disassociate your hips and your low back when you're moving. And a lot of people with low back pain have a hard time moving from their hips and hinging from their hips without also moving in their low back. And that extra excessive constant movement in their low back is a large reason why they're overusing it and abusing it, and it's getting angry and it's just never getting stronger. So with the RDL, I'm going to first show you right now how to do it and how to think about your hips. So when I am simply just pushing my hips back and leaning forward, what you'll see is that my spine, my cervical, thoracic, and lumbar spine is staying in one fixed position. What's moving is actually the way that my hips are moving over top of my femurs, but my back itself, my spine, is not moving at all. And now what I see that's often incorrect about this is people start to engage the movement from their spine before they go down. And we've done other videos where we've gotten a good bit of depth on the RDL, which we can link here. You can also feel free to interject and in the comments below tell us what you like to think about and your success with the RDL. But I just want to cover the broad strokes here of it is a movement from your hips, not from your spine. Your spine needs to be strong, stable, and stiff. Your hips need to be strong and mobile. And so I am moving here, and then I'll get the benefit of the hamstring, glute, and low back strengthening. So if you were to add weights, and I really like using dumbbells so that way you can keep your center of gravity in the middle, you're going to push your hips back while your chest comes down, and you're going to come back up. And now I don't care if you pride yourself on a really deep forward fold where you can bring your chest all the way to your thighs. That's great in your yoga class. That's not what you're doing with an RDL. With an RDL, you should at the very most be achieving parallel with your torso in the floor and then coming back up. Controlled down nice and easy and then coming back up. You should be aiming for about 10 to 15 reps of this. If you could do 15 reps in 3 sets and you're like, God, I don't even feel anything, that means that the weight is way too light. So prioritize control of the movement, your form, and trying to maintain 10 to 15 reps placed into your workout regimen once a week or so with, obviously other good exercises in there. That's not the only thing you're doing on that day. But RDLs are fantastic. You can get into single leg variations and things like that, but that is beyond the scope of what I want to cover right now. While we're here standing, I want to cover a goblet squat. Now, I want to take just a brief second to talk to you about, should you squat to parallel or should you squat A to G or butt to grass, right? It is a complicated question that involves significantly more factors than how our great ancestors once stood or squatted and how they ate and literally sat around each other. Some of us simply will never really be able to get their butt all the way down to the ground because of anthropomorphic measurements, like their femurs just being way too long and their torsos being way too short, and they're just falling backwards no matter what they do because they have this mechanical disadvantage. So that's just the beginning of it, right? It gets complicated, but for what we're doing right now with this goblet squat, you should be trying to get as low as you can. When you're doing your own squats for strength purposes, whether you go to parallel or below parallel depends heavily on what you're trying to accomplish and why. So for this, I want you to go as low as you can go, right? And I want you to maintain the position of your spine as you rest into the bottom here, and then come on up. So I tuck my elbows in a little bit. Make sure you don't jam your elbows into your knees. So you'll do, again, about 10 reps, maybe a little bit more, getting as low as you can go. Come back up. My feet are going to be angled about 0 degrees to 20-ish degrees. There's some debate over how much rotation's okay, but some rotation is okay. Just don't be excessive about it. Drive those knees forward because they do need to go over your toes, and you need to sit as low as you can. I'm trying to decompress my low back. I am using this depth and range of motion to take the stress, the strain, the tightness out of my low back, and simultaneously strengthening my hamstrings, my glutes, my quads, getting myself stronger, making sure my low back is more fortified. If you have to, you can begin with just squat, whoops, okay. You can begin with squatting to a box or to a bench or to a chair, just to make sure that you don't have your back go into a spasm if that is of your immediate concern. But if you're feeling confident and ready, again, squat as low as you can go. There may be a little bit of movement at the bottom. You shouldn't just be dumping and rounding down here, but you will get a little bit of a pelvic tilt as you get below a certain point. It is natural, it is normal. And again, this is less so about being perfect in every single rep, but using this exercise as a way of strengthening and stretching to get yourself to a place where you're closer and closer to being perfect. So use light weight, again, use weight that's light enough to make sure that you can play around with this movement and not be at any risk of hurting yourself. And then prioritize form and sets and reps. And then you could increase weight to continue to challenge yourself within those parameters of three or four sets, 10 to 15 reps. With squats, I tend to think that 10 is enough, but you can always go with more reps. Now, for the third and final exercise of, by no means a comprehensive list of everything, but the meat and potatoes of helping your low back get stronger, bridges. We have gone into depth on different variations of bridges in our YouTube library. We'll link them here so that way you can continue to follow those. But just to go over right now, again, 3 sets of 10 reps or so. I'm gonna show you the standard bridge. So I'm gonna have both feet down. I'm gonna rest on my back. My head is on the ground. I'm using my bun like a pillow. And then what you're gonna focus on is broad strokes of this, right? Squeeze from your glutes, get yourself up on your shoulders a little bit, and then come back down. What you shouldn't be doing is you shouldn't be arching in your low back and then kind of shoving your gut out. I'm not trying to do a wheel pose or position here. So you need to make sure that this part of you stays nice and flat or straight, and that you're squeezing through your glutes and your hamstrings and coming down. So another way I like to visualize that is, so from your knee to your hip to your shoulder should be more of a straight line, and you shouldn't see bowing up and you shouldn't see bowing down either. So once you squeeze your glutes at the top, that's all you're going. You're not trying to find a way to get more by moving in your spine. Again, this plays on that idea of, are you able or capable of moving through your hips without recruiting your low back as well. Again, do about 10 to 15 reps, 3 sets, could be 4. If I were to do this or have you in front of me, what I would say is you'd be moving between the bridges first, just so we can demonstrate how you are moving from your hips versus your spine and using your glutes. Then we would do some RDLs because we like playing on that idea of we just kind of patterned this, let's take advantage of it. And then we'd get into the goblet squats as another way of now moving in a different way through your hips without involving your low back. So those bridges, squats, and RDLs are a fantastic way to begin to strengthen your low back, especially for those of you who are just looking for some path to start on. If you're looking for more direct guidance and help, we will link below more resources from us, including our MD Fit programs, which are one-off programs that we've made where we program literally in what you need to do, and we create like a 4-week routine for you. But for those of you who want to run with this on your own, again, I highly suggest watching our complete YouTube library and the series that we're covering on low back pain and other variations here. And please comment below with as many questions as you might have, so that way we can continue to help guide you, but also give us any of your own personal experience, so that way we can all continue to grow together. I'm Doc John from Mobility Doc. Thank you for watching.